This is WTXL 7. Today we will talk about the overview of performance measurement. The definition of performance measurement is according to Health Resources and Service Administration, performance measurement is a regular collection of data to assess whether the correct processes are being performed and desired results are being achieved. Why is performance measurement important? Help you understand how well your organization is accomplishing this goal, and analyze where and what changes need to be done and made in order to improve performance and the quality of care provided. Allows providers to understand what is working well and is often shared with other providers who can use the advice. Measurement categories: structure, process, and outcome. Structure measures the organizational capacity and the conditions in which care is provided by looking at factors such as organization staff.
Measurement perspectives use structural measures that have several features as indicators of surgical quality. Surgical outcomes are strongly related to many variables. Hospitals of high volume have at least a 10% lower mortality rate than low volume medical centers. The major advantage of structural variables is expediency by providing quality care while being convenient and practical.
For an outcome advantage, most consider patient outcomes the bottom line with surgical practice. The book explained that advantage example could be morbidity and mortality rates, functional health status, and attention satisfaction and cost. Another example could be the percent of patients whose insurance cover all of their medical expenses.
Disadvantages of the outcome measures. As we may know, outcome measures are related to sample size. The articles explain on a specific surgical procedures, the mortality rate of cardiac surgery. The surgeons would be the numerator and the case would be the denominator. The percentage would be higher for a similar hospital, for a smaller hospital, because it has less surgeries and less surgeons. Example 2 would also mean that if a performance measure was done and how many premature babies survived the first month, the numerator would be the babies that survived, and the denominator would be the total number of babies.
The example which was provided in the book is on patient mortality to measure the outcome of healthcare services. The sample size limitations as a denominator, the surgeons can determine mortality rates after reviewing the outcome of a range of procedures provided. Very few hospitals have sufficient adverse events and cases for meaningful procedure-specific measures.
Good afternoon, everyone. We are Group 7, and today we reported on outcome measures. My group members include Aaron Ravel, Aaliyah Holiday, Ursuline Austin, and Pearson Marvell. And myself, Kamisha Freeman. This is WTXL 7 reporting live.